All right, good evening, everyone. My name is Kemley Phillip. I'm the academic chief resident here for our PM&R residency at the McGovern Medical School, UT Health in Houston, Texas. I just wanted to say a quick thank you first to the PM&R scholars for putting this event together, coordinating all of this between the many different institutions and giving our students an opportunity to still learn about the different residency programs amidst the ongoing pandemic. I am actually going to turn it over to two of our all-star PGY3s who are going to be doing most of the talking. The first of which is Dr. Heather Nauman. She's our Associate Chief of Wellness in our program, in addition to Dr. Aaron Lynn. And he's one that won't let us give him a chief title yet, but I'll actually turn it over to them, and I'll be available throughout the session as well. If you guys have questions, they'll put our contact information on at the end. But with that, I'll go ahead and turn it over to Heather and Aaron.
Hi, everyone. Thanks for paying attention and for coming to join us. So I'll go and get started, an overview. Here's a quick picture just of where most of us train. And then this is our lovely group. We do love to have birthday celebrations. This is just documenting all the lovely times we eat cake. The bottom picture actually is pre-COVID when we all could be together, and then the top ones are post-COVID when we had to do them individually.
Yeah, that's at the bottom, that's Kathy, our program coordinator, and the man holding the cake is our program director, Dr. Frontera. So we'll get started.
So our program is under many names. We go by McGovern Medical School at UT Health. You can also see it as the University of Texas Med School in Houston, and also just simply UT Houston. So when you're on like ERAS, and you may have to look at different, maybe labeled a different title than just UT Houston, which is usually what we call it, or just McGovern. Also our program chair, as in the picture, is Mr. Gerard Francisco, and our program director, who insisted on this photo. He's a huge Star Wars fan, is Dr. Frontera, but you saw his real picture in the slide before. And just to keep you guys aware, he's a huge Star Wars fan, and his original presentation, there's probably 1 million Star Wars references, but I would not do it justice, so I had to take them out. So sorry for that. So he's our chiefs, Mr. Sam Kim. He is our admin chief. And then, as you just met, Kemley Phillip, she's our academic chief and also helps with our quality improvement projects. And then myself is the associate chief of wellness. So here's our residents. This is our newly, freshly minted intern class. They just started here, and they're doing fabulous. Everyone so far has been handling this COVID situation very, very well. Here's our lovely PGY2s hanging out post-COVID. And here's our PGY3 class, all pre-COVID. And our PGY4s. So where do we rotate? Besides the main 2 facilities, which are our inpatient rotations, we also have the opportunity to have other experiences. So we also rotate at Memorial Hermann Orthopedic and Spine Hospital doing MSK and also pain. We also rotate at Shriners Hospital for our pediatric rotations. MD Anderson for both, we do kind of the consult inpatient experience, and you can also do a pain experience if you choose. And we do our EMGs at Smith Clinic, which is part of the Harris Health Community Hospital system here in Houston. And then these are the main hospitals, especially for intern year and most of your second year. So the top left is just main Memorial Hermann, and in the bottom 2 is the tier, which is the inpatient rehabilitation hospital. And then the top right is LBJ, the main inpatient experience you would have doing community type health and inpatient during your intern year. We also do consults there as well. So here's a kind of a I would say basic, but it's kind of complicated, map of the Texas Medical Center. It's pretty large, but you see on the red dot is where tier the inpatient unit hospital is located. And if you can't really see it, but in the very top back, you can see Main Hermann, top right, kind of.
Don't worry, there are more aerial photos to come.
But just to get a picture of kind of the size. So here's Main Hermann, where again, most of your first year will be spent, in addition to a good chunk of your second year as well.
Yeah, we'll talk a little bit more about this later, but for instance, when you work at like such a large facility like this, we find that the variety of pathology is like bonkers, really. So the building over here is all dedicated to trauma. You can see the helicopter pads up top. This building right here, an L shape, is all heart and vascular. The Heart and Vascular Institute, so a lot of LVADs, a lot of heart transplants. And then you have the other buildings here. I think this is Jones. And those are, that's where a lot of the neurologic floors are, and that's where our rehab unit is.
So Memorial Hermann, just briefly what Aaron already mentioned, is a level 1 trauma center. It's a very large hospital. It's over 600 beds. And you definitely will, if you're on the consult service, you will get to see a wide variety of pathologies, like everywhere from, basic orthotraumas, severe spinal cord injuries, from stroke, you have your LVADs, amputees, you name it, you will get to see it at Hermann.
Also at Hermann, we have our inpatient rehab unit, which is housed within the hospital. It's 12 beds, and that's where you get a good general rehab experience. It's pretty impressive. Again, pretty impressive, the pathology that you see. And then the consult service is also housed in the same area. You'll see everything that Dr. Nauman had already mentioned, and possibly more.
And so another part I know a lot of people really enjoy, as well as myself, is doing sports, MSK, interventional pain type medicine experience. And so our faculty are John Sianka, Jason Chen, and Dr. Ajay Sabasivan. And during your second, third, and fourth year, you get plenty of experience being able to do, ultrasound injections, you name it. They'll probably help you try and be able to achieve what you'd like. They also have clinics at the MHOSH hospital, which was shown earlier, and they do consult services. Well, Dr. Sambasivan and Dr. Chen do consult services at the tier inpatient hospitals, so you can spend a month. That's actually the current rotation I'm on, and we do a lot of ultrasound guided injections daily. Those are the numbers, I guess. I think those were taken from last year's data of the average number of procedures done just between those two facilities. And for our pediatric experience, we do it at Shriners Hospital. You also, when you're on the consult service at Main Hermann, you also do get consulted to see pediatric cases as well. And the faculty for our pediatric group is Dr. Vasquez and Dr. Hall. And you do everything from, they have their own inpatient rehab unit, but you also get to get good experience with orthotics and seeing all the complications with spina bifida and cerebral palsy. Also doing in their clinic, in the outpatient clinic, they also do injections too, which is also a really good experience. And there's no call during that month.
Over at MD Anderson, like we mentioned before, you do get a good cancer rehab rotation, as well as an interventional pain rotation, where you learn how to do chronic pain management with cancer patients, as well as the more complex interventional procedures. Our educational curriculum is it's all grouped into one morning out of the week. It's on Thursday mornings. It's a combination of lectures as well as hands-on workshops. We have people who work with orthotics come and do demonstrations for us and show us different things that they use. We have spasticity workshops. We learn about EMG, ultrasound. There are small group sessions where we get to do diagnostic ultrasound with each other, as well as the skills labs where we get to learn how to do joint injections and interventional spine injections. We do have a comprehensive cadaver MSK course that's led by a, anatomist, and it's all really built into that MSK course. So you do get some time cadavers. We always have to do a QI project that's led from PGY 4, 3, and 2. We also have grand rounds. It's usually every 2 months or so. It's been a little bit different the past couple of months. We have a series called Disability in Film where we go over to Dr. Bosca's home, and we actually get to watch and dissect representation of disability in film, as well as our critical review of literature, where the PGY3s do a really deep dive into a topic that they're really interested in, to see if there's something that we can actually parse out and see if there's some kind of new research project that we might be interested in. We just have a couple of pictures at the end as well. Oh, we're going to go through our schedule as well. This is an example of us going over intrathecal baclofen pumps. These are our orthotics people coming to talk about orthotics and amputation medicine. These are some examples from our grand rounds. We had a really interesting one where we talked about sexual health and both brain injury as well as spinal cord injury. These are some pictures of us doing ultrasound. More ultrasound. Like I mentioned before, we do spend a lot of time actually doing the really big presentation with, and joined in with the Baylor residents as well. These are our PGY3s from last year presenting their critical reviews of literature. A little bit more about our schedule, because I know we're running out of time soon. So again, we take four residents a year, and we are categorical. So our schedule is for intern year is 4 months of internal medicine wards. You get 2 months of ambulatory clinics, which is a mixture of different specialty clinics, a month of the medical ICU, rheumatology consults, neurology inpatient, geriatrics, inpatient, cardiology, and then you also get a month of PM&R, the light at the end of the tunnel. Heather, do you want to talk about these?
Oh, sure. So once you finally get through your intern year and you finally get to do PM&R, this is kind of what a rough estimate of kind of what your years will look like. Your second year is still mostly inpatient. You will spend most of your time doing inpatient at either a tier or at Memorial Hermann, the inpatient unit there. You also get 2 months of consults. You do have a nice little reprieve here and there of MSK month, get to kind of get your toes wet with ENG for a month. And then you also can have an outpatient opportunity. The nice thing with the EMG is I was able to do almost, I think we have to do 200 by the end of residency, and I finished half in that 1 month. So it's a very high volume. It's definitely easy to do after like 2 months of it, or you can also do more if you just want to be more adept at EMG. And then your third year, a little less inpatient. So each year kind of a little less inpatient, a little more outpatient, kind of get to specialize more into what you're interested in. If you want to do more cancer rehab, you could possibly, do 2 months of cancer rehab, or if you want to we offer a business course, you had opportunity. And if you prefer to do more inpatient, that's always an option as well. Definitely more flexibility in your third and fourth year than in the second. And then for your fourth year, you're mostly all outpatient. And again, if you want more inpatient experience, if you know you're going to go into inpatient after graduation, that's definitely an option that you can, your last couple months before boards, you are more than welcome to have that as your option. Our administrative chief will send out an email at those times and kind of get your input on what you'd like to have for your experience. So call, everyone's favorite topic, love it. So at tier, when you're on your inpatient months at tier, we do have an in-house call. It's a 24-hour call. So it's 8 to 8. The nice thing that we have now is we do have nurse practitioners who are available with you overnight for rapid responses or any critical medical situation to kind of help, especially if you're busy handling all the other patients in the hospital. So you do have help there. At Memorial Hermann in the acute inpatient rehab unit there, it's home call. So you will cover maybe a weekend or during the weekday. It's either a 4-day if it's during the week or a 3-day during the weekend. And again, it's home call. You have to go in for emergencies, but most of the things that we've been paged on can be handled at home. And we also we don't have moonlighting, but we do have this extra backup call called EBC. And it's for any admissions that come after 5 p.m. If more than 3 come, you can activate the EBC to come, and you will get paid based on the number of admissions you do in the evening. And that starts your second year of residency. And so just to wrap, so we do have fun. We do have free time. This was a group before we started our second year. We had a group hang out again, pre-COVID, sad times. But we all got together. Everyone brought food. It was like one big charcuterie board, and everyone brought their kids and played, and it was a great time. We also have time to volunteer. We have a clinic called the RSVP clinic for people who, underserved community, help assemble their wheelchairs. There's also opportunities to volunteer in the clinic. We also have Best Buddies, and it was a great experience to be able to volunteer for the Houston Marathon. We actually had 2 cardiac arrests that we got to assist with and help. It was pretty intense, but it was a really cool experience. Huh? Oh. And here's our lovely scholars presenting their research. And we also have one of our quality improvement projects was to have these physician-initiated group discussions where they help with everything from professionalism to presentations. And so we had different topics, and each attending hosted at their house and allowed us to all come in their homes. We all brought food and gained a lot of knowledge, kind of the outside knowledge from the clinical work. It was a great experience. We also make time for things that are socially important to us. So this was our group participating in the Black Lives Matter March here in Houston. And we love to eat. We had, pre-COVID, we had probably a family dinner at least every maybe 4 or 6 months. Everyone would come, bring their families. It was a great time. I think we're trying to figure out when it will be safe again to do this. Or Dr. Francisco actually mentioned that he's going to try and order a bunch of food and have us all pick it up and then we'll all have a Zoom meeting and eat it together as a group. So trying to adjust to these crazy times, but it's definitely food is an important part to this program. And we were having joint lectures with Baylor. So this was at Christmas time. We all did a sock exchange with everyone. One of our wellness activities we did early in the year was rock climbing. And we did it with Baylor. And this is Rhea and Christina showing off their moves. You're good. And this is how our wellness activities have been since COVID. We're trying to have kind of a wellness group happy hour the first Friday of every month, just so everyone can talk, see each other, vent, we all really, I think for me, one of my favorite parts of this program is my co-residents. And I think it's one of the, I don't know if Erin wants to speak on this too, but it was one of the main reasons when I interviewed, I knew it was like a good fit for me, just the vibe of everyone. I really got along with everyone well. Here's a group of us post-COVID, hanging out, socially celebrating our graduates who are leaving us. Erin, your mic isn't working, I don't think. Oh no. Oh, there it goes.
My AirPod stopped working for some reason. Anyway, again, yeah, completely agree with Heather. Our residents, I think, are some of the best people that, you know, I have the privilege of sharing this journey with. It's been really, really good. You know, I think that you should always try to feel out the culture of any residency that you're trying to figure out. And, you know, best of luck to everyone. I think we're out of time.
Perfect.
So,
Perfect. Thank you so much. That was great timing. Oh. And maybe if you want to, leave your information there for students to contact you. And thanks so much for that.